So I've mentioned that the male reproductive tract has accessory glands, and the accessory glands are really important in producing the semen. The semen contains sperm, but it also has to contain this other stuff. And so the first accessory gland that we're going to talk about are the seminal vesicles. So the seminal vesicles are important, and they actually, their stuff that they contribute actually makes up 70% of the ejaculate. So 70% of the semen is produced by this gland. So when we look at this, it is thick and it tends to be alkaline. So it's thick and alkaline. So basic. So it has a high pH. It has primarily fructose, which is a nutrient that the sperm uses, sugar that powers the mitochondria of the sperm. And then it also has citric acid, which is a necessary nutrient, and a coagulating enzyme. As well as, just one enzyme, as well as prostaglandins. So one of the interesting things about this coagulating enzyme is that when the sperm is first ejaculated into the female's vagina, it turns thick and it coagulates. And in some mammals, it actually forms a plug. And eventually what's going to happen is there's going to be an enzyme that breaks down the thickness of it to allow the sperm to move. But the coagulating enzyme, its function is to prevent backflow of the semen out of the female's reproductive tract. So the sperm could just, or the semen could just flow right back out. So if it's thick, it's not going to be flowing back out as much. The prostaglandins are really interesting because this actually causes contraction of the smooth muscle in the female's reproductive tract. So the prostaglandins help to move the semen up into the reproductive tract, which would increase the likelihood of fertilization. Okay, so the other glands that we're going to talk about include the prostate gland. And the prostate gland, its components are a little bit different. And so it is actually slightly acidic. And it is actually kind of, they say it's milky. So it's milky, milky and acidic. It contains citrate, which is a nutrient. It also contains anticoagulating enzymes that will help to break down that coagulation and allow the sperm to eventually swim. And then we have what is called a prostate specific antigen, or a PSA. So this is important in the detection of prostate cancer in males. So they often use this as an indicator for prostate cancer. And this makes up about 30% of the volume of the semen. Finally, we have the bulbourethral glands. These produce pre-seminal fluid. The importance of the pre-seminal fluid is to lubricate the penis, but also it is important in removing any leftover urine from the urethra. urine can be acidic, and that could kill the sperm. If it's too acid, it will kill the sperm. And so when we look at that preseminal fluid, generally it doesn't have viable sperm in it unless the male has had an orgasm recently. So if a male has had an orgasm recently, there could be residual sperm in the urethra, such that that preseminal fluid could contain sperm and could possibly be a source of contraception, pregnancy, unintended. So that's the preseminal fluid. So those are the 3 glands that are considered accessory glands to the male's reproductive system.